afternoon. My name is Amy Jo Baker. I've been a registered dietitian for the last 11 years, and I currently work at a small nutrition consulting firm. I'm also a student at Rosalind Franklin University of Medicine and Science, completing my Master of Science degree in clinical nutrition. Today I will be presenting this paper by Kandahar and colleagues called Clinical Trial Multi-Species Probiotic Supplementation Alleviates the Symptoms of Irritable Bowel Syndrome and Stabilizes Intestinal Microbiota. The topic of irritable bowel syndrome and probiotics is of particular professional and personal interest to me due to the large number of patients with irritable bowel syndrome who come to our office seeking help, as well as my history in the hospital setting treating these patients and using probiotics. So first I will give you a brief background on this topic. Irritable bowel syndrome, or IBS, is the most common diagnosis in gastroenterology. It's a chronic functional GI disorder estimated to affect 1 in 5 adults in the Western world. It is characterized by often debilitating abdominal pain, bloating, abnormal bowel movements, such as alternating constipation and diarrhea, in the absence of structural abnormalities. IBS causes a significant financial burden to the healthcare system and a reduction of quality of life to those afflicted. Many trials suggest that certain probiotics are beneficial in alleviating symptoms of IBS. And the literature describes how certain probiotics may be used as a means to target and manipulate the gut microbiota. It is suggested that imbalanced intestinal microbiota, which can be seen in IBS patients, may activate mucosal innate immune responses that increase epithelial permeability, thus disturbing the regulation of the enteric nervous system. And many researchers theorize that it is this disturbance in the autonomic nervous system that may be an important factor in the pathophysiology of IBS. The literature also suggests that imbalanced microbiota may also trigger mucosal inflammation. The following research question was identified as per the author's study. In adults with IBS, the administration of a multi-species probiotic drink effective in improving GI symptoms as measured by the composite IBS symptom score and bowel habits, improving quality of life as measured by health-related quality of life questionnaire, stabilizing intestinal microbiota as measured by HIT chip analysis, and reducing inflammatory markers as measured by C-reactive protein and serum cytokines as compared to a placebo. Now we'll discuss the methods of the study. This was a randomized, double-blind, placebo-controlled parallel group intervention that lasted 20 weeks. There was also a preceding 3-week washout period and a 3-week follow-up period. Subjects included 86 male and female IBS patients who were recruited by an experienced endoscopist in primary healthcare offices in the city of Tampere, Finland. Subjects were included if they met Rome criteria 2 for IBS. They were 20 to 65 years of age. They had a colonoscopy or barium enema of the colon within 5 years. They had a normal blood count and normal kidney and liver function. Subjects were excluded if they had a history of organic intestinal diseases, complicated GI surgery or abdominal adhesions, severe endometriosis, malignant tumors, if they were pregnant or lactating, if they had dementia, or if they were taking antibiotics within the last month. So our intervention, that group received a once daily 1.2 deciliter milk-based drink containing multi-species probiotic, and this included Lactobacillus rhamnosus GG, L. rhamnosus LC705, Propionibacterium freudenreichi SSP, Shermani JS, and Bifidobacterium animalis SSP lactis BB12. Wow, that's a mouthful. And the control group was given a placebo drink with similar milk-based characteristics. So our outcome variables. The primary outcome variable was the composite IBS symptom score, and secondary outcome variables were individual IBS symptoms, quality of life, microarray-based intestinal microbiota stability, and serum cytokines and sensitive C-reactive protein. So at a glance, here are the main results of the study. Provision of probiotics showed significant effects on severity of IBS symptoms, especially on abdominal pain and distension, quality of life, and stability of intestinal microbiota. No effects were observed on inflammatory markers, and no differences between groups were observed in the prevalence of soft stools, hard stools, or diarrhea. So here we have an outcome variable table for the primary outcome variable for probiotic versus placebo at baseline versus 20 weeks. I'd also like to briefly clarify how the primary endpoint was measured. The composite IBS symptom score was comprised of abdominal pain, distension, flatulence, and rumbling. Each symptom was rated from 0 to 28 with a total composite IBS score range of 0 to 112. Now, the composite irritable bowel syndrome score over 20 weeks decreased by 14 points from baseline with the multi-species probiotic versus only 3 points with the placebo. The p-value here was 0.0083. Therefore, this represents a mean reduction of 37% in the IBS group, in the probiotic group, compared to only a 9% reduction in our placebo group. So next, we will review the Table 2, secondary outcome variables for probiotics versus placebo at baseline versus at 20 weeks. For individual IBS symptom scores on the scale from 0 to 28 as we described, please note the decreases in symptom scores in the probiotic groups as compared to little or no change in the placebo group. Note that especially changes in abdominal pain and distension were much more mild in the probiotic group. The p-values for those were 0.052 and 0.23 respectively. For quality of life, based on health-related quality of life questionnaire, the probiotic group showed a median change of 0.62 points versus only 0.37 points in the placebo group. The p-value here was 0.045 for that difference. A stabilization of the microbiota was observed as the microbiota similarity index increased with the probiotic supplementation while it decreased with the placebo. Please note that a high similarity index between the two time points denotes a stable microbiota. P-value here was 0.0015, which is very statistically significant. And then for CRP between the two groups, no differences were seen. That p-value was 0.21. Note that serum cytokines were not included in this table because the authors reported that a high percentage of the baseline samples were below the detection limit, therefore they cannot be statistically analyzed. And now we arrive at the discussion portion. So the results of this study were consistent with the author's previous findings regarding a similar multi-species probiotic. In that study, a 42% reduction in composite IBS symptom score was observed, and recall that a 37% decrease was observed in this study. A recent systematic review and meta-analysis was conducted by Hoveda et al., evaluating the efficacy of probiotics in reducing symptoms of IBS. Included were 14 trials from 1989 to 2007, examining 24 to 274 IBS patients given various single-strain and combination-strain probiotics over study lengths from 4 weeks to 6 months. Combined data suggest modest improvements in overall GI symptoms over several weeks of treatment. Now, Kandahar and colleagues also mentioned that their findings of beneficial effects of distension and pain are consistent with findings in other studies that certain strains of lactobacilli can induce expression of pain-sensing receptors in gut epithelial cells. Also, this study was among the first studies to include health-related quality of life measure and to investigate the possible modifications of gut microbiota, as deviations in intestinal microbiota are often seen in IBS patients, and that may play a role in the pathophysiology and inflammation. So the authors concluded that the multi-species probiotics studied appears to be an effective and safe treatment option to reduce symptoms of IBS, to stabilize the intestinal microbiota, and improve quality of life. Areas for future research should focus on identifying the mechanisms of the potential beneficial effects of probiotics, and also why certain probiotic strains are effective while others are not, and this is largely unknown. So in critically analyzing this article, the strengths of this study: it was a well-designed, double-blind, placebo-controlled, randomized, parallel group intervention. It had a modest sample size, a long study length. It included multiple outcome variables that assessed different facets of IBS. The authors also presented a couple of limitations in their study. They were unable to measure the serum cytokines, thus limiting the data on inflammatory markers. And then also, analysis of intestinal microbiota was only completed in 20 patients, and the authors mention a tremendous challenge in this task, notably that microbiota comprises more than 1,000 bacterial species. So lastly, I would like to make a final statement. In analyzing this paper by Kandahar and colleagues, we may answer yes to the research question. However, many variables must be considered when investigating the effects of probiotics on such a complex functional GI disorder as IBS. And these include the various probiotic strains that are used in these studies, the different doses, the duration, the different types of GI dysfunction, and the unique variations in each and every IBS patient. And these factors are definitely evident when looking at the varying results of studies that have been published since this paper. So with that said, this concludes my presentation, and here are my references, and should you have any questions, please post those in the forum, and thank you for your attention.